We remove the eye from the orbiter completely and they dissect it, and they would like to show you exactly what I mean with the rectus muscles, the four rectus muscle. This is here the dorsal street muscle of the eye, the ventral street muscle of the eye. This is the medial street muscle of the eye, and this is the lateral street muscle of the eye. And as I told you, there are two oblique muscles, one located ventrally, so this is ventrally, this is the ventral oblique muscle of the eye, and this is the dorsal oblique muscle of the eye. As you can see, yeah, so rectus muscles, they start from, the outside surface of the eyeball, and normally they move, backward. Of course, they just reflect them to the side, okay? And now, once we remove all of this, let me just, move to the side and show you the retractor muscle. This is the retractor muscle. As you can see, it surrounds, or comes from the all surface of the eyeball and moves also caudally. This is the retractor muscle of the eye. If you want to see the optic nerve, you have to dissect between this muscle, and after that you can see, of course, the optic nerve moving backward toward the